Okay, we might as well get started and people will probably trickle in. But my name is Leddy and I'm a medical director at knownwell. So I'm an internist and obesity medicine specialist, and I'm so happy to be here along with my colleague, Dr. Laura Mayol from Talkiatry. We are here together, because we work very closely in collaboration and a lot to talk about today as it pertains to kind of mental health and weight, especially during Mental Health Awareness Month. So, one of the reasons we're here this evening in May. Dr. Mayo?
Hi, yes, thank you for having me this evening. Very exciting to be here. As you mentioned, I'm Dr. Laura Mayol. I am one of the chief psychiatrists with Talkiatry, which is an outpatient telehealth company. And this is a very exciting topic to be partnering on.
Great. Thank you so much. My name is Jenna Todick, and I'm a nurse and occupational therapist by background, also part of the Known Well team, and super excited to be here with Dr. Leddy and Dr. Mayol, and just really excited to, again, be part of this conversation this evening. And love to start with kicking us off tonight with how about we just start with maybe explaining in just some really simple terms on how the brain and the body are in constant conversation and why mental health and weight are so deeply linked together.
Yeah, I would love to start with that. So think of the brain and the body as being on a constant phone call. They're always talking, never on hold. The brain sends signal through hormones, the nervous system, neurotransmitters that influence everything from how hungry we feel to how our body stores fat. And then the body signals right back what we eat, how much we move, how well we sleep. All of that shapes our brain chemistry and mood. So mental health and weight aren't two separate problems. They share the same wiring. And when something goes wrong in one system, you almost always see ripple effects in the other.
Yeah, I would just add to that, it's something in medicine. It's one of the most interesting relationships, in that they're inextricably linked. So we call it the gut-brain axis. So kind of that idea, it's a two-way highway, not a one-way street. So the back and forth. And if we think about, I'm going to throw out a couple hormone names, but just to describe that communication and how she described it, kind of that constant communication. So our hunger hormone is produced in the stomach. Well, where does it impact our appetite? Here, centrally in our hypothalamus. So our appetite center is in the brain. So produced in the gut, communicates with the brain. Same goes for satiety hormones, those that tell us we're full, that off switch, as we describe it. Also produced in the small bowel, so the gut communicates with the brain. The hypothalamus is actually a shared part of the brain, so meaning it's our appetite center, but it's also part of what we call the mesolimbic system, which is our reward pathway and also in part related to mood. So a couple other neurotransmitters, and then I'll get out of the weeds, but just to say some that you'll be very familiar with. So serotonin, dopamine, norepinephrine. These are oftentimes we think of them in the context of mood and medications to treat mood, but they also, serotonin, for example, 90% of it is produced in the gut. And they all impact how we eat and what we eat, interestingly enough. So just to say that you cannot tease them apart. They are so closely in communication.
Absolutely.
Dr. Leddy, I'm getting some in the chat. It sounds like folks can only see the person who's speaking. And so I don't know if there is a setting that we can do to show everybody all at once. And I don't know if you might have access to that.
Oh, I don't. I'm just taking a look. I show captions. I do not seem to. 'Cause, 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 No, I don't see an option to share. So they're not seeing you or Dr. Mayo.
Yeah, only able to see the speaker versus everybody all together.
Oh, it's selected panelists and attendees. I'm sorry for folks only staring at me. Um,
So I think we can go ahead and move forward, and we'll see if
yeah,
we
I'll
can.
continue to troubleshoot. I
Yeah, we'll
apologize.
keep
I'm
we'll
not
keep
seeing anything to switch. Yeah.
yeah we'll keep troubleshooting with if we can figure it out. So as we continue to move forward, and maybe continuing on the space of the mind body connection. Um, how does mental health affect weight, and how does weight affect mental health? How do those interplay together?
Yeah, so it's it's a little bit of a chicken and egg situation, and it's both ways. And that's exactly what makes it quite tricky. For example, depression can lead to changes in appetite, reduced motivation to move, disrupted sleep, which all can drive weight gain. But then carrying extra weight can lead to stigma, joint pain, fatigue, lowered self-esteem, which feeds right back into the depression or anxiety. And it sort of becomes a cycle that is hard to break when you're only treating one side of it. That's why integrated care matters so much. And we believe that you have to address both simultaneously.
Yeah, I would just echo the same. The other thing is that there's increasing body of evidence that weight increases systemic inflammation, and that inflammation, so kind of chronic inflammation, can also lead to increased rates of depression. So again, kind of that chronic systemic inflammation. So that's the only other thing I would kind of add to that, but certainly intricately related.
Absolutely.
So I think in that same line, thinking about chronic inflammation, chronic depression, some of those things. What about chronic stress? What role does chronic stress play in, especially in the area of like cravings? So specifically for high sugar or high fat foods.
So chronic stress is a really powerful driver of cravings, and there's solid biology behind it. When we're stressed, the body releases cortisol, one of the hormones. This one is the stress hormone, which actually signals the brain to seek out quick energy sources. And what's the quickest energy source available? Sugar and fat. So that reach, maybe for a cookie or for chips, isn't a character flaw. It's your stress response doing what it was designed to do in a survival context. The issue is that most of us aren't running from predators. We're stressed about work emails, family pressures, relationship stress. And when that stress is chronic, cortisols can stay elevated, and so do those cravings.
Absolutely. And I would add to that too, keep in mind those types of foods, what we kind of consider highly palatable foods, as I put that in quotes, but all the good stuff, right? The fat, the sugar, the salt, that activates our mesolimbic or kind of dopamine system. So it gives us kind of temporary relief to stress. And sometimes the more we have, the more we want, but at a certain point, kind of that chronic stress can lead to, different kind of patterns of eating, including stress eating, because it does cause a temporary relief. The other thing I just would associate with increased stress, oftentimes our sleep is disrupted. And I know we'll get a little bit more into this, but sleep disruption, so inadequate sleep or fragmented sleep. So, for example, in the context of sleep apnea, again, even that raises cortisol levels, so stress hormone levels. but it also does funny things to our hunger hormone. So for example, ghrelin rises when we don't get enough sleep. And leptin, so ghrelin again produced in the stomach, our hunger hormone, and leptin, which is produced in our fat cells, actually falls. That communicates to our brain and tells us we're full. So it's kind of an indirect pathway, but nonetheless, increased stress we all know can impact sleep, and sleep impacts those hormones as well and disrupts patterns of eating.
So that's a lot. And then the stress eating, how is that the same or different than emotional eating?
Yeah, I think it's you know, it can be a coping mechanism, and also a physiological response. And I think it's important to say that out loud because people often shame themselves for emotional eating when it's actually a very human response. On the physiological side, food, especially comfort food, like you were mentioning, triggers dopamine and serotonin release, so those feel good hormones. So it literally makes us feel better, at least briefly. And then on the psychological side, eating becomes a learned coping strategy over time. So, for example, if reaching for food helped soothe difficult emotions at some point in your life, the brain files that away as a useful tool. The challenge is that, again, it works in the short term, but creates a longer term problem. And it never actually addresses the underlying emotion that's driving to eat.
Yeah. And I guess I wouldn't, I think there's a lot of overlap, kind of stress eating and emotional eating. Emotional eating is the use of food to manage negative emotional stress. So whether it's stress, whether it's loneliness, boredom, anxiety, grief, we do this for many reasons. But I think what is so important is what Dr. Mayol just pointed out. We tend to beat ourselves up over this quite a bit. And it is something that, again, there is a physiologic response. There's a reason that it happens, and it's a coping mechanism. So meaning there's actually impact on the brain to kind of, calm us. I will say, there can also be kind of diminishing return, for that coping strategy. So oftentimes we may find, if we're drawn to highly palatable food for that kind of dopamine response, or increase in parasympathetic tone. So that's our rest and digest access instead of fight or flight. We need more, so oftentimes we tend to eat more to calm us more. So it's kind of one of these vicious cycles. But I just want to reiterate, it's something that is very common, and something that we work with daily, and that it can be addressed both in our clinic at Knownwell and along with Talkiatry. But easy for me to say, but I know a lot of my patients talk about it with shame, and there's a lot of science behind it, just to point out.
Thank you, Dr. Leddy. That's really helpful. Take a quick pause here. Two things. First of all, for anybody who has questions, please go ahead and, if you have a question, go ahead and put it in the Q&A, and we'll do questions now. We'll do them as we go along here. If there's any feedback, questions, comments, please go ahead and put those in, and we'll address them now. And then we'll also take some time towards the end and do questions as well. And then we did have a suggestion, Dr. Leddy, I think since you're the host, if you go to the top right, where the top very right, and choose gallery view. If that is not selected, that might be able to put all of us on. Maybe try that and see if that brings all of us up instead of just one at a time.
I think probably it will. Simple fix. So
simple fix. We'll take it.
Oh, are we in business? We're in business, I think.
All right. Well, we'll let somebody tell us in the Q&A.
All right. I hope. Thank you to whomever added that. Very simple fix.
All right. Looks like that fixed it. All right. Thank you. Thank you so much, Dr. Fitch, for helping guide us through all of that. And thank you all for your patience with that. So we've talked about chronic stress and cravings, and we've talked about emotional eating, and also like how much of that physiological response is in there. How does that interplay with food noise? And how does that impact or correlate with what is food noise? And how does all of that correlate and impact together with stress eating, emotional eating, and because we hear it so, I mean, food noise is so much a part of what we hear and talk about.
Yeah, so food noise is a term that's been getting a lot more attention lately, and it describes that constant mental chatter about food. So thinking about what you just ate, what you're going to eat next, whether you should eat something, bargaining, planning, and even obsessing. And for some people, food is just fuel and they don't think about it much between meals. But for others, food occupies a huge amount of mental space all day long. And this is very common in people who struggle with anxiety, depression, even ADHD. It can be very exhausting, it's distracting, and it often drives impulsive eating decisions. And I know we haven't gotten into the GLPs, but one of the things patients on GLP-1 medications frequently report is that the food noise just quiets down, which has really been illuminating in terms of understanding how brain chemistry underlies this. And I think maybe Dr. Leddy can tell us a little bit more about that if you'd like.
Yeah, sure. I think just going back to the kind of food noise, how disruptive it can be for some. I always say there of course is normal hunger, and going back to what you were saying, if signals are working as they should, so to speak, we get normal hunger cues. If we go a full day without eating, our ghrelin, our hunger hormone, rises and we feel hunger. And some of that is normal, right? So longer stretches. But then this is really that constant chatter is disruptive. So I think that's the key that is different. That it can be really disruptive to day-to-day quality of life, and really unsettling and disturbing, and really, like I said, disrupt quality of life. I think when it's present and disrupts quality of life, we need to help. And in terms of what contributes, I'll tell you, it's all the things we just mentioned. So again, and when I say that, it's very much neurobiology, right? So those hormones do play a role. Like if we have high levels of ghrelin circulating, we are going to have kind of constant hunger. If our leptin is lower, or there's what we call leptin resistance, we won't feel as satisfied. But then stress, poor sleep. The other thing I'll mention, diet culture, right? We've been told that if we just restrict, we're going to lose, right? Well, restriction, intentional restriction, can actually cause that constant hunger, and constant food noise, I should say. So the biology, again, neurobiology is very much a part of food noise. And we'll talk more about GLP-1s, but just to say there are some, stress reduction can play a part, working on sleep. And not to say it's the only part, of course, because the medications also work on that neurobiology. But there are some other things that can help. Just briefly, going back to sleep, for example, we know that we wake up in the morning after, or don't wake up if we didn't get any sleep, but after, sleep disruption or inadequate sleep. And our ghrelin is higher than it would have been otherwise, and our leptin is lower. So what gives us our off switch? And there are several studies that suggest we may consume 200, 500 more calories per day as a result of that, just due to that kind of constant hunger and noise related to increased ghrelin. So just to say that's not the only piece of it, but things that we can, why it's so important to work, both with us and, on mental health and behavioral health and sleep. All of these things go together. So critical to kind of quiet that food noise.
Absolutely. I think that's something that we can work on. We can target with some cognitive behavior therapy, different modalities to address sleep, for example, and just stress overall.
Yep.
Yeah. And we've definitely talked about, like, we've really hit on the how much the disruption of sleep can really impact all pieces of this, right? The the hormones and food noise and just also stress and depression. Are there pieces of sleep hygiene that are part of the treatment plan that we would for both for weight management and then also for mental health that would be part of things that we want to cover today?
Absolutely. De Depression and anxiety and other mental health diagnoses often disrupt sleep. And like Dr. Reddy was saying, the science is pretty clear, and the hormone that makes you hungry. So ghrelin and leptin is the one that tells you you're full. And when you don't get enough sleep, the ghrelin goes up and leptin goes down. So you wake up hungrier, takes more food to feel satisfied. And studies have shown that even just 1 or 2 nights of poor sleep can measurably shift these hormones. So when you layer that in with the fact that depression and anxiety chronically disrupts sleep, you start to see why people with untreated mental health concerns often struggle so much with appetite regulation. It's not willpower, it's hormones that are being thrown off in part by sleep deprivation. So definitely sleep hygiene is something that we can always work on as part of the treatment plan, discussing um, things like not being on electronics up until or watching bright computer lights or TV lights too late into the evening. So trying to wind down and do things that are relaxing so you can cue your brain uh, to wind down and slow down and have less of that stress. And those tactics can be very, very beneficial, very helpful. But again, we are talking about neurobiology and chemistry here, and sometimes um, that's a great add-on, but it might not be the only thing. We might need to target it more aggressively with medications.
I'm just curious. I hope you don't mind me asking. I always am when I'm talking to my patients about sleep hygiene. Do you have apps that you recommend? I know we say don't be on a screen and yet use an app, but there are some that have been demonstrate, kind of effectiveness for insomnia and sleep issues. Do you have any favorites? I use CBTI, which was developed by the VA system, but are there others that you recommend that have been
I
shown to?
What I tell my patients, there's so many. There's Calm,
Yes.
there's Headspace or Headway.
Yes.
There's
Yeah.
so many out there. I think they're all wonderful in terms of content. It can be a meditation, it can be a white noise. I think a very important part of it is, yes, you may use these apps to help you relax and unwind. And I think the most important is part of it is don't have your phone in your face,
Yeah.
right? So make sure you put it face down so that that light isn't affecting your circadian rhythm, and keeping you up even later. But I think those are wonderful tools to utilize as adjunct treatment. But again, they all have I let patients kind of pick which one's
Yeah.
best for them, and just kind of counsel on how to use them and how to make sure that they are helpful and not disruptive to their sleep.
Great.
Super helpful. So a couple things from the chat. One from Dr. Fitch, that CBTI app called REST, R-E-S-T, that she really likes, that really helped with some of her perimenopausal sleep issues, that's really helped with her sleep hygiene. So app
Great.
called REST. I've not heard of that one, so thank you so much, Dr. Fitch, for kicking that into the chat. And then another one from the chat that actually goes right into one of the next topics that we had on here that we've alluded to and that we wanted to chat about also is medications, and especially mental health medications and weight. So one of the things that we wanted to talk about was, Social Dr. Mayol is talking about what medications are most likely to affect weight, either in one way or the other, right? And why? And then the specific question we got in the chat was, how do SSRI antidepressants affect appetite? So both sides of that, both the specifically to the anti-SSRIs and affecting appetite, but then also what medications affect weight, both sides, up or down.
Yeah, absolutely. And many patients are concerned that psychiatric medications can cause weight gain. And this is one of the most common concerns that I do hear. And it's a legitimate one. And patients deserve to have honest conversations with their prescribers about this. So for us, some antipsychotics, particularly olanzapine and quetiapine, are well known for causing significant weight gain, partly because they affect histamine and other receptors that regulate appetite. So by way of increasing appetite, they can cause weight gain. Um, and again, they affect other receptors that regulate appetite. Some antidepressants, so particularly mirtazapine, which is not an SSRI, but paroxetine, which is, are also heavily associated with weight gain. However, on the other hand, there's some SSRIs that are relatively weight neutral. And for example, there's medications like bupropion, or the brand name is Wellbutrin, or it can be found in Contrave. And these are associated with some modest weight loss for some people. And the why varies. Again, some medications increase appetite directly. Some may cause cravings. Some may slow metabolism slightly or affect how the body stores fat. I think the most important message is that not all psychiatric medications will cause weight gain, right? And when one does, there's oftentimes an alternative, and that it's very important to discuss this with your psychiatric provider rather than avoiding treatment out of fear, because again, there's always options to those medications. So definitely, yes, some SSRIs can cause weight gains, but some can be very much weight neutral, and some can cause slight reductions in weight. I think it's also important to remember that when we are treating disorders like depression and anxiety, once your mood, energy, motivation sort of start improving with the use of a medication, it may be easier to engage in healthier coping skills in general. So that includes practicing better sleep hygiene, maybe planning meals, and having less impulsive eating. So a lot of these, again, a lot of these medications can have that side effect, but it shouldn't keep people away from seeking treatment.
Yeah, I think that's so important. I'm so glad you raised that, in that, I think one, the importance of having the conversation both with your primary care, weight management provider, but then also mental health and psychiatric provider and clinician. I'd like to think, I hope, I certainly know Talkiatry, but I'd like to think clinicians are more aware and sensitive to this, meaning people are working really hard at losing weight with the biology and really looking for more weight neutral options, but also recognizing that mental health is so important. So if you are feeling lousy because of depression and anxiety, and it's limiting your ability to prepare food, to sleep well, that we may opt to keep you on a medication that's really improving those symptoms, if we find one that works. So although we always want to try for a weight neutral option or something that's not in the SSRI or SNRI, like bupropion, which may actually promote some weight loss, either on its own or in combination in the form of Contrave, sometimes we can't. Sometimes we want to make sure, if the mood responds, we keep you on that med and we try to work with other meds. One thing I will say, this is where we work very closely together. If we have to, just because mood improves on a medication that may have impacted weight, we can help combat some of that, meaning sometimes we use metformin along with atypical antipsychotic medication. Sometimes we start people on GLP-1s very early on if we're seeing a weight trajectory that is upward trending, so I just, but, please, I hope, have some comfort in discussing with your clinician that you're actively working with someone, weight management at knownwell, on weight loss. And I do think people are a little bit more in tune and sensitive to that. But certain your psychiatrist and weight management provider can help guide you there as well.
Yeah, I think we're always having, or we should be having these conversations with our patients in terms of potential side effects. And there are times when it might be more appropriate to pick a medication that perhaps has that potential for weight gain. But I think it's very important to disclose that to the patient, one, so they're prepared. And two, it also opens the door for the patient to say, oh, I'm also working with
Yes.
someone over at knownwell, for example, to work on my weight. So there's many things that are taken into consideration or should be taken into consideration, and conversations you should have with your doctors before starting a medication, or maybe even if you are on a medication before changing a medication. But again, there's options, right? So it's better to have those options than to not treat it at all.
Yeah, that's right. Yeah.
Yeah. Thinking about the other direction of medications, there are a lot of conversations happening out there about the potential impacts of some of the GLP-1s, semaglutide and tirzepatide, potentially having impacts on mood. What are you both seeing clinically, and what is also the research saying about those potential impacts?
Yeah. So this is a really exciting area for me, I'm sure for you guys as well. The clinical observations are fascinating. I think many patients report improvement in mood, reduced anxiety, better overall sense of well-being on these GLP-1 medications, and also that quieting of the food noise that we mentioned earlier, being part of that. So the research is early, but there are mechanisms, because GLP receptors are not just in our gut, they're in the brain in areas like you were discussing that are involved in reward, mood, and cognition. So there's also even some preliminary data suggesting that it could be neuroprotective, these medications. Again, it's all relatively new and still being studied. There are a very small subset of patients who may report worsening mood or increased anxiety. So again, it's not that it's all uniformly positive. I think for us in psychiatry, the takeaway is that we need more research to understand who will benefit, and just close monitoring, especially if you have a patient that has a mental health condition or a predisposition, and or just existing mental health conditions. So but we are also seeing research suggesting that medications like semaglutide, which is and you can comment more on that on Ozempic,
Yes.
but can help people with depression feel more motivated. And so one of the more debilitating symptoms of depression and other psychiatric illnesses is the feeling that nothing is worth the effort. And so this is a small study, but it was a 16-week trial where people took semaglutide, and essentially they became more willing to put in effort to earn a reward compared to those who were not on the medication. So what it seems like is like the tasks seem less exhausting and more worthwhile for the patients. And this is again very significant for this particular symptom of depression, because low motivation and the inability to enjoy rewards is notoriously difficult to treat with any of the standard antidepressants, SSRIs, SNRIs. Sometimes it's one of the harder symptoms. So for me, it is very exciting to see that there could be a potential path forward to help with mental health conditions that have that affect motivation as well. So that's kind of what I have seen and what's exciting to me about the GLPs. But you probably have a lot more experience
Yeah.
with that.
No, I think you hit the nail on the head. I mean, I would say in practice, anecdotally and, kind of population health, real world, most commonly reported mood effect is positive. We see it, again, I think you relayed some of the most important pieces of this. Like we talked about how debilitating and how disruptive, I should say, food noise can be to quality of life. And that kind of settling is incredibly freeing. And I oftentimes see that people feel more optimistic after starting, GLP-1. And to your point, this is a really exciting area to be watching right now. There's so much happening in kind of research. I mean, there are a few animal studies that I'm getting kind of into, not human studies, but even some, keep in mind, GLP-1 receptors, again, as you pointed out, are also in the brain, including hypothalamus, but also limbic regions. So,
Right.
which is kind of mood and reward area. So there have been a few, kind of animal studies that demonstrated even anxiolytic or reduction in anxiety, on GLP-1s. Again, animal studies only, but exciting just to say, that we're seeing some of these relationships. We also, again, I'm glad you kind of mentioned that study, so JAMA Psychiatry that, last month, that is a huge, the impact on motivation, to your point, is huge in the context of depression. So that is really promising and exciting. There are still, in some of the behavioral health and mental health studies, there are still significant confounders. So I will say there's a lot that we still have to learn. I think what we can say with confidence is that, kind of mood effects both directions are biologically plausible just based on kind of location of receptors. One thing I do want to mention, because it made, of course, headlines over the past several years, were reports of increased suicidality on these medications. And I do want to be clear, that's one thing that was looked into in great depth by the FDA, just in terms of impact on specifically kind of suicidality. And that warning label has been removed from these medications. So I want to be clear. I know that came up and made headlines, actually for a few years, and there were significant concerns. So I do want to say, that has been removed. But we take this all, I think the other thing is we monitor, we take this all very
Right.
seriously, So I think by far the majority of people we see positive impact, but I listen to every single person, if they notice disruptions in mood. I don't see it frequently, but I take it very seriously. So I think we're constantly observing and working with our patients, but by far, very positive impact. And actually one of the reasons I love this field. Yeah.
Yeah, I agree. It is very exciting overall with that recent study, and the fact that they did remove the label for the suicidality. There were no completed suicides, and that's just important to notice. But
Yes.
if you are ever feeling like your mood is worsening or your anxiety is worsening or you're having thoughts of not keeping yourself safe, it's important to know where to look for help
Absolutely.
that
Yeah.
get immediate help. It's something we want to know. Your primary care wants to know, your psychiatrist wants to know. We want to work to make sure that you're not having a potential side effect of this medication, and you're maybe the rare exception, but we do take it very seriously. And I think it's just very important to continue to screen and to talk to our patients, which is, I think, what knownwell and Talkiatry do really well.
Absolutely.
Yeah. Yeah. I mean, that is the one thing knownwell and Talkiatry are in partnership, right? We do integrated care. And um, what does that actually look like in practice? I mean, how do we work together to treat the whole person?
Yeah. So integrated care essentially means that both the medical and let's call it the mental health teams, because it's also part of medicine, but they're in active communication. So you're not just sending a referral to the void and hoping for the best, right? So the integrated aspect is, so let's say a patient at knownwell maybe struggling with depression or anxiety, they can be referred to psychiatry, and that same the other way, right? So a patient at psychiatry who is struggling with their weight, we can refer to knownwell for additional medication management and just management of the weight concerns. And so when you treat both things in a coordinated way, medication decisions get made with awareness of both the mental health aspect and the physical, the weight health. And I think care plans can be built together. And then also that removes the patient as being stuck in the middle between doctors, playing their own, which is, I think it's very important that patients advocate for themselves, but they shouldn't be stuck in the middle trying to relay information between disconnected providers. And so that coordination sounds simple, but it's actually rare and really, really valuable. So I think that's one of the reasons why this partnership is so important, because I think treating depression and obesity is separate silo, and that goes for depression, anxiety, ADHD, any kind of mental health is not going to work as well as treating them as the interconnected issues that they are. So I think that's the best way that I can describe our care coordination. And it's essentially just being able to communicate and just knowing that your patient is being cared for by one or the other party. And so just awareness can make a huge difference for patients.
Yeah, no, absolutely. I mean, I think your point about care team, I know, I hate to say it, but modern day healthcare, it is oftentimes so fragmented. So having kind of a care team with communication, if, of course, if okay with you, our patients, then,
Right.
yeah, but absolutely, assuming they're on board, we are too, because I think we come up with kind of a collaborative path forward. Or collaboratively, create a path forward. I also just will say, your offerings, there's therapies, but also, if we need to discuss medications, we have, of course, psychiatrists like you. So I think that is also nice. Some of my patients aren't quite sure about medications yet for mood, yeah, but they benefit tremendously from therapy. So having those offerings is also very important. And
Absolutely,
yeah.
yes. And at Talkiatry, we can definitely see patients only for therapy, and they may opt to do therapy for a period of time and then change their mind and decide that they do want to pursue medications. But it's very easy to coordinate the care once you're in our system. And so I think it's very important in my opinion.
Yeah.
Yeah, fully agree. Um, Out to the audience, if there's any questions, comments, if you have any questions for Dr. Leddy or Dr. Mayol, please go ahead and put those into the Q&A, and we will definitely tee those up for either of them. So feel free to drop those in. In the interim, another question for both of you in the, being that it is Mental Health Awareness Month, for especially for our patients or our colleagues or anybody out there who is, well on the weight loss journey, but not yet on the journey of addressing their mental health, what would you say to folks that are not quite on that mental health journey yet?
Yeah, I would say, you haven't tried everything yet, right? And so sometimes folks feel like maybe they have tried everything, but if you haven't addressed your mental health, um, you haven't tried everything yet. And that's actually hopeful news. So you may have tried the physical side of a problem that has a significant mental health component. So there's untreated depression, slowing your metabolism, your motivation, or untreated anxiety, driving stress eating, or trauma that's showing up this complicated relationship with food. I don't think there's any diet plan or exercise regimen that is going to fully work because you're not addressing the whole picture or what may be in the driver's seat. So it shouldn't be viewed as a personal failure. It's a systems failure. You didn't have the right tools for the full problem. And so I think addressing the mental health piece isn't giving up on weight loss. It's finally giving yourself a real chance at it. And so that's what I would say to someone to give that an opportunity, give that a try, because I think it makes the world of a difference.
Um,
Yeah.
yeah, I'm gonna two quick questions I think directly relate to that. One is I think really relating, does the mental health issue need to be tied directly to weight?
That's a great question. Absolutely not. I think we can treat a variety of mental health issues. It's just that we very often see that these mental health issues, a lot of mental health diagnoses have changes in appetite as part of their presentation. So this is why we are discussing it in light of changes in weight. But certainly it doesn't have to be tied. I think just treating the person as a whole is very important and absolutely doesn't have to tie into weight. If you're not feeling well, please seek help from a psychiatrist or a therapist.
Absolutely.
Yeah. And I think again, they absolutely. I mean, I think we do not give our mental health and wellness enough attention, both individually and in the kind of healthcare system. So it does not need to be tied. But I think to your point, the reason we're talking about it so much is that there is tremendous overlap, with the neurobiology, but absolutely, I think it's important no matter what, even if unrelated to weight. Yeah.
And another one, I think this is a really, really good one from the Q&A, because I think this is very much out there and very much a topic of conversation. And I'm just going to read it directly from the Q&A. Lots of people online are saying the opposite around GLP-1 medications, that they make you feel less motivated. So, we hear this online as Ozempic personality, due to the decrease in the reward pathways, or even a decrease in sex drive due to the reward issues. Can you comment on that?
You know,
Yeah.
it's interesting.
Yeah, go ahead. Go
Yeah.
ahead.
No, so Dr. Fitch actually did a segment on this very topic, on television not that long ago. I will say I've been in this field a long time. This is not to, kind of, downplay what is being reported, but anecdotally, it is not something I see frequently, so again, I would say kind of real world. And this is something, again, we just said we need more studies on this. There's a lot to be learned. But I would say in practice, in the many years I've been in this field, I have not had a lot of reports of kind of mood blunting. And if anything, by far the most, what we're seeing, and again, need more real world studies, but kind of what we're seeing is, positive impact. But it is something I'm aware of. And I'll see if I can find it and share in the chat. But Dr. Fitch addressed this very topic recently. So
Yeah.
yeah, do you have thoughts on that?
I agree. I think overwhelmingly, I am seeing patients um, feel better. A lot of them feel like they're getting back to being themselves after many, many years of struggling. Um, but again, we welcome the research and more information. So that's why it's so important for whoever is on these medications to communicate with their provider, because we do take these concerns very seriously. And um, there's there's options even within the GLP medications. There's different different categories there that can be explored, and so um, if your mood is being affected, I would say talk to your primary care about that. That's really important, and you may want to look into getting additional treatment for mental health.
Yeah.
Um,
And I just want to add to that again. I don't want to downplay. I really encourage my patients to tell me anything that hasn't been reported, even, right? To share with me. But I will say, just in practice, it's not something
mhm.
I've seen a lot of. I can't find the exact link, but it was CNBC recently. If people are curious to see that clip. But I think the importance of letting us know, anything that's different for you that is impacting quality of life. I've said it multiple times over the course of the discussion this evening, but I think that's huge in terms of how it impacts our life and our quality. So, again, not something I've seen, but talk to us about it.
Absolutely. Same thing here, please.
Yeah.
And I'm loving the comment also here, and endorsing fully. Please get your weight care from someone who also discusses your mental health with you versus getting your meds from a form on the internet. Go to a clinic that takes care of the whole you.
Yeah, that's
Yeah,
great.
I think that's very, very important.
I
Uh, yeah,
agree.
yeah, fully agree with that. And I think that kind of leads into a really great next question. Oh, and Dr. Fitch just dropped the link to the CBC
Oh, good.
video into the chat. So
Yes.
for hopefully all
I
of
think
you
it's
can see
topical.
that.
Yeah.
Let us know if you can't, but hopefully y'all are able to grab that
That's
that
great.
video.
Yeah.
What is a question that you wish your patients would ask more often about the connection between mental health and weight?
So for me, I think when I think about that, I would say is, do you think my mood might be affecting my weight or vice versa? So most patients might come in with just one presenting concern or problem and don't necessarily connect the two. But when a patient opens that door themselves, it really makes the conversation so much easier, more productive. And I wish more people felt empowered to ask that, because the answer is almost always yes. And having the conversation with your mental health provider can change the whole trajectory of their care,